Imagine sitting with your child in the outpatient ward in our burns department. You are nervous and unsure about what is to come. A scream echoes down the corridor to you, intensifying the fear and worry you already have for your child. Soon you will discover that your child will need their dressings removed, their burns scrubbed, and new dressings applied. Despite adequate pain medication, this is still going to be painful and distressing for your child. You may even need to hold them down so the nurse can do their job. This is the experience of many of the 1,200 children who come to our burns ward every year. Most of these children are 4 years old or younger and are heavily reliant on their parents for cues on what to do in these unfamiliar situations. Families and their children who have sustained burns are more likely to go on to develop psychological disorders such as post-traumatic stress disorder, depression, and anxiety. It is clear that we need to be doing something more to help these families. Unfortunately, when we conducted a systematic review of the literature to try and see what interventions are currently out there, we found very little. Most studies are very poorly run and show very limited abilities to actually improve outcomes for families. One of the main reasons for this is because it's very hard to actually engage parents in interventions, especially after they've left the hospital. Our solution to this was to train the staff instead. If we can get the staff to be more mindful of the ways that they are treating families when they come into the outpatient ward, we can affect a larger number of people. My study is looking at how parents receive care both before and after we conduct this training with the families. While it is still early days, we know that despite finding the experience traumatic, parents do say that their overall experience at the hospital is positive. This primarily is due to their relationships with the staff. Families who feel like they've had a positive connection with the staff and been supported throughout their journey are more likely to say they've had a positive experience. The other thing that is very important for the families is that they are given enough information to understand what is going to happen to their child. If you know what the future for your child is looking like and what you need to be preparing them to go through, you are more likely to be able to manage this as a family. While it is still early days with this research, and we don't know what is going to change after we've done this training with staff, it is clear that we have a few areas which we can target with these families. No longer should children have to be scared every time they come into the hospital. Families should not have to be terrified for the future, unsure of what is going to happen or what is to come for them. Thank you for listening.